It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join Paul David and Jen Cohen as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives in Yavapai County. And now, here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it is great to have you in studio with us today. Cherry Virrey is in studio today, Public Health Nurse and Disease Prevention Supervisor with the Yavapai County Health Department. Website for you is yavapaihealth.com. Instead of trying to read out phone numbers for Prescott Valley, Cottonwood area, it's just easier if you go to yavapaihealth.com and contact us, and it gives you all that information right there. Hello, Cherry.
Good morning.
It's been a year. I think almost an exact year since you've been here.
I think so.
Yeah, I think it's been almost an exact year. We're kind of recapping what we were talking about last year, and we're probably going to repeat a lot of that this year, but there's going to be some differences and changes and stuff like that. And Cherry's here because it's flu season time. Flu season is coming up just around the corner. Both Yavapai County and Coconino County sent us press releases saying, okay, we're ready. We've got our flu shot supply. That's not going to be an issue this year. I don't think it has been for a couple of years where everybody
it's been a couple of years, so
yeah.
We're pretty much on target this year.
I think we had one year where it was like this shortage, or a couple of years where there was a shortage of it, or not enough was made, or the wrong one was made and they were trying to catch up.
Yeah.
But that's not an issue this year. So what I have off the press release that was sent out by your office is flu season October through May. That's a big chunk of the year. Is that right?
It is. Mm-hmm. And for us, though, it's actually year-round.
Okay.
It never stops.
Explain that.
We see it all the time. And even this past year, over the summer, hopefully if our epidemiologist gets a chance to come in, we saw high peaks of it in June and in July.
Oh, no kidding.
Still rolling into the summer months. We were just waiting for it to close and close and close. And that never really did happen. Part of that is better surveillance systems. We're getting more timely information, so it just looks like there's more cases, or it's going for a longer period of time. But again, it just goes back to the technology is improving.
You know, we see that a lot. I asked that question too from folks that come in here. I said, okay, is it up? Is it down? Is it about normal? But I think that is the case right now. Just the reporting of it is gotten better and better. Is that it?
It's greatly improved.
Yeah. So June and July. So when did our flu season actually, does it end anymore?
No.
Okay, so I get the flu today.
Yes. In our eyes, it truly doesn't.
Okay.
And we hold on to our flu until the very end of June before sending it back, especially for our travelers. So at any point during the year, there is no right or wrong time to get the flu. As soon as it's available, you want to get it. But you, at any point during the year, it's important to have.
And traveling is obviously, that's how things spread, is the travel. You get one person who's got the flu, gets on an airplane, starts coughing. I mean, that's the big scare someday, right? Is that the big one hits by traveling across the world.
Oh yeah, that's what runs you into a pandemic. And most of your studies on any of your, vaccine preventable diseases, tuberculosis, airborne diseases, were all studied in airplanes. So we know exactly how far ahead, how far behind, and how far next to us those respiratory diseases spread and how quickly.
And they do spread fast.
Yes, they do.
One cough, and there it is.
That's it.
There it is. Now, you wanted to hit something before we got too far into the show today, and I thought that was kind of interesting, the 1918 flu. So Cherry's going to take us on a little trip back in time and take us back to 1918 and talk about the flu that happened then.
Well, we're coming upon 2018. This is technically the 2017-2018 flu season. So we are right on the brink of the 2018 flu season, which is a century past the last largest pandemic the world has ever seen, and that was the 1918 Spanish flu. Okay. So for that is a great accomplishment in public health. That is a unbelievable that in a century we have not had something on that scale, and that is from having a vaccine to prevent it.
100 years, blink of an eye for you, do you think? Just a blink of an eye, isn't it?
Oh, yeah.
How fast that goes by?
It's very quick.
And you think about 1918, 2018, people think, wow, 100 years, but really 100 years is hardly even measurable almost.
Pretty much. And when we look at it, we look at those who are descendants of, or those who were young at the time during that survive that, because that was devastating, absolutely devastating.
Do you have numbers?
No, I don't.
You don't? Okay.
I'm sorry.
Okay. Well, that's okay. That's all right. That's all right. I was just kind of curious how many people actually were annihilated by the Spanish flu, but it was a lot.
It
would
was,
definitely say that.
When they were looking at some of the stuff that was going on during that time, during the wars, it surpassed those who were lost during the wars of that time.
Oh, wow.
So if that tells you anything, that a bacteria or a virus can kill somebody quicker, than a war, and take that many more lives.
Right.
How important that is.
Wow, that's crazy. All right, so back to flu season. It's here, and now we're understanding that flu season's pretty much year-round, but there are peaks to it. I think the press release you guys sent out, which you had not gotten a chance to see, but what it said was October through May was the flu season, the so-called flu season. I'm putting air quotes in the air. How ridiculous! But it is. There's a peak 4-month period where it's like, oh boy, the flu is really ramped up, December through March.
Well, we see it in terms of almost 2 peaks.
Okay.
So the first part of the flu season, from now until about January or so, is typically the A strains, and so those peak December, January, and start tapering off in February. And then we see a secondary peak in the spring to summer, which are the B strains, and that's where our second peak comes in.
Okay.
So there's not just a single peak in there. We watch this on graphs and data, so we can see that we're having a peak of the A strain or a peak of the B strain, and it's typical. The A generally falls in the winter months, and then the B in the spring. And we also see those people who, should have bought a lottery ticket, because not only did they get the A, we also get the report on them that they got the B.
Oh, boy.
And so how unlucky are you there?
Pretty bad.
Yeah.
Yeah, it's pretty bad. So let me ask you this. In past shows when you've been here, or anybody from the health department's been here, we've talked a little bit about the fact that the northern hemisphere during the summer months is watching the southern hemisphere to kind of see what flu's rolling around, and that determines what kind of flu shot is developed. So what was done this year? Can you tell us what it was like for Australia and the southern hemisphere, flu-wise?
Well, one thing, and it's still very big in the news, is Australia. They're dealing with a very virulent A strain, which circulated with us about 2-3 years ago, and that was not a component at that time of the flu vaccine, and has since been integrated in. But unfortunately, they are contending with, even late in their season, of that A strain, and so that's predicted to impact us first.
Let's take our break. And when I come back, I want to find out what an A strain is and a B strain is. All right, can we do that?
Sure.
When we come back from break? Okay, all right, great. Public Health Nurse and Disease Prevention Supervisor Cherry Virrey in studio today. Yavapai County Health Department, their website is yavapaihealth.com. Stick around, countywide, back in just a couple minutes.
Listen to me. I am captain of the track team. And if I'm late,
she doesn't really think she's going to get out of here, does she?
Be nice. She's new.
Hello, is anyone there? Ugh!
Wow. Even from our standards, you look awful.
Oh, sweetie, what happened?
Me? My friend Becky got to talk to this super cute boy, and I tried to act like I wasn't jealous, but I so totally was. And then out of nowhere, this concrete barrier just popped up. Maybe it was a semi.
You mean you were driving?
Yeah. I mean, I know the whole eyes on the road thing, but this was a super important text. Maybe you have to know, Becky.
Texting? Great.
But it was only like 5 seconds, and I'm a really, really fast texter, so it wasn't even a big deal. Actually, has she texted me back yet? Wow, I get like no bars in this place. I wonder if they have Wi-Fi here.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, you know, she's putting them in the same basket. Again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
The Q102.9 plays all the hits.
Yo, what's going on? This is Drizzy Drake.
Ariana Grande.
Maroon 5.
This is Rihanna.
I'm Shawn Mendes.
Hey, it's Bruno Mars.
Ed Sheeran.
What's up, guys? It's Justin Bieber.
You're listening to The Weeknd.
Start your day with Brian James in the morning. He'll get at least 10 songs in a row during your ride home with Julie Page.
Zach Sang Show.
Catch the Zach Sang Show weeknights 7 to midnight. And Kelly Fox weekends on your home for hit music. The Q102.9 and 104.9 in Prescott and Cottonwood.
Welcome back to Countywide. We're talking flu season. Kicks off October and runs through May. That's the good news. YavaPaiHealth.com is a great website to go for more information or to schedule your flu shot. Flu shot clinics are going on. Matter of fact, I was going to say, while I was driving into work today, Cherry, and I noticed that this is what brought it up that Cherry was probably here about a year ago, is that Cornville has the big road signs up. This is flu shot clinic coming up. I can't remember what date it was.
It'll be this Saturday.
This Saturday.
From 1 to 3 at Windmill Park.
October
30th.
September 30th.
Oh, I'm sorry, September 30th.
September 30th, yeah, September 30th at Windmill Park. Cornville's going to have their thing. And I remember last year when you were here, I actually drove by that sign, and you had come in that day, and we were talking about it too, and you were going to be there. Are you going to be at this one too?
No, I have somebody else going out.
Get somebody else. But anyways, flu shot clinics are going on, and we can get them through the Yavapai County Health Department.
Yes.
We get them through our own doctors, all right, if they've got a supply.
Doctors, pharmacies, health department, any of those.
Any of those.
As long as you get it.
Yeah. YavaPaiHealth.com again is the website. Now, we were to come back and you mentioned, you say A strain, B strain. What is an A strain flu?
A strains are more of your pandemic type flu, your H1N1s.
Okay. Swine flu.
Swine flu,
that
exactly.
That was a big one a few years back.
Yeah. So those are the ones that cause pandemics. Okay. Those are the ones that go nationwide and worldwide and also create more devastation to a person and require hospitalization.
Okay.
Not that the B strains won't, it just depends on the individual.
Can you say what's in an A strain to make it so much more dangerous than the B strain?
I don't think not in the terms that you're looking for. It would be too technical.
A strain, though, is typically one we're going to see during the winter months.
Yes.
Okay, that's what I think you were saying earlier, from say, through December, January, when the real cold months are here. A strains are roaming around.
Yes, and those will peak at that point.
Okay, and then B strain is we're switching from winter to spring. Do these things kind of go with the seasons? Is it just that whole change in the weather pattern, stuff like this?
Not really. No? It's just, I wish I had a graph or a board to kind of put that up, looking at the A strains, but the amount of B strains is so much higher.
Okay.
There's so many more of them because they've been circulating for hundreds of years.
Okay.
But when you look at your B strains, they're named after the areas they originated.
Oh.
Like the cities.
Okay.
So, or states.
There could be a Cottonwood B strain out there?
There could be.
Okay.
There very
I got
well
the old
could
Cottonwood.
Be. Yes.
Okay. All right. Okay.
So that's how they're named, and those are the ones that are changing throughout the flu season.
Oh, okay.
And so that's why most people have that hesitation. You cannot squish all those B strains into one vaccine, nor would you want to until they find a safe method of doing it. So those things are going to change and mutate throughout the year depending on who gets it.
Which they do.
Yes,
okay,
they typically do. But there's also what I refer to as like a cousin association. So some of them have some lineage association, like a cousin or something. So when you get the flu vaccine, there's that potential for it to be related. So if you were to get it, the effects of it would be severely lessened.
So the flu vaccine is kind of developed in a way to, well, you're saying there's hundreds of different strains.
There is.
Or maybe thousands of different
thousands.
But this is kind of a light blanket, maybe, a light net that can possibly catch a whole bunch of different kinds. And, well, we can hit on this one, this one, this one, this one.
Yes.
But we can't do all of them. But we might it might protect you from, say, this 100 that come along.
Yes.
That pass your body.
Yes. And that's something. So when you're getting the flu shot year after year, may still contain, the first 2 A strains, and then it's the B strains that commonly change. And so each year you get it, you're adding to yourself an additional B strain because the other ones still continue to carry over. So you're providing yourself with more and more protection as time goes on.
You're putting this into your immune system?
Yes.
Is that it? Okay.
Yes.
Okay.
So it's ready to combat it when your body has to face it.
Okay. All right, that makes sense. Okay, that's interesting. Okay, so that's A and B. A in the winter, B in the spring. Okay, so there are certain folks out there that should really consider getting the flu shot that may be more susceptible to catching the flu than others. I have not had the flu in...
Is that what
yeah, there we go. I want to say, I can't remember the last time I had the flu. Let's put it that way. It's been a long, long time. But there are folks out there who are more susceptible every year to getting that. Who are these folks, and who should really be thinking about getting that flu shot, other than just saying everybody?
Well, to start out with, yes, everybody. Everybody's flu shots start for infants 6 months, and the age range goes all the way up. Those who really need it are those with pre-existing medical conditions, respiratory conditions, asthma, diabetics, COPD, those who are immune compromised. They need that protection. Mm-hmm. And we also need it in order to protect them.
What if I say to you, I don't want immunizations. I don't like immunizations. That's been a big thing last, I don't know how many years, but you hear that a lot where people say, oh, I don't want to be immunized.
I hear that all the time. Mm-hmm. And everybody has different reasons. The most important thing I think that I can say is it's a preventative measure. When you look at getting the flu vaccine or any vaccine, it's a preventative measure. It prevents you from going to the hospital. It prevents you from getting medical treatment or having medical treatment unnecessary done to you, and it prevents unnecessary medical bills.
What's a flu shot cost?
There's places where they're free. Mm-hmm. They typically average about $48.
Okay.
But overall, most...
If I go to the hospital,
but when you
for
compare
complications of the flu.
Complications of the flu, and one of the biggest complications is pneumonia.
Okay.
So if you have, again, a compromised immune system, respiratory conditions, that's the first place it's going to go is straight into your lungs.
It's a big bill.
It's truly a huge bill. Mm-hmm. And especially now that we're kind of reverting back to the 80s of those HMOs and PPOs with those high deductibles that a lot of us are having to contend with, and that fear of having to use our medical insurance because we have a high deductible. I would rather take the opportunity and prevent it. And I would rather take the time and go on vacation than spend it in a hospital.
Right.
And the other is, because like you and I talked about, also working in the hospital, that when people come in, the other thing is people talk about, the side effects of vaccines. I really recommend, filtering, looking through your research. When the same companies that make our vaccines are the same companies that make all the medications that are on the market today, and that includes everything in the pharmacy and in the hospital. And there are far more side effects to an antibiotic, and we have antibiotic resistance, and nobody wants to be put in that position. And this is a way to prevent antibiotic resistance.
Okay. All right, let's take our other break, okay? Public Health Nurse and Disease Prevention Supervisor Cherry Virrey in studio today. Website for you, YavaPaiHealth.com. Stick around, Countywide, back in just a couple minutes.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Virrey Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Virrey Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Virrey Village, and from 26 locations in Cottonwood. With Virrey Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Virrey. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
The Q102.9 plays all the hits.
Yo, what's going on? This is Drizzy Drake.
Ariana Grande.
Maroon 5.
This is Rihanna. Mateo.
I'm Shawn Mendes. Hey, it's Bruno Mars. Ed Sheeran. What's up, guys? It's Justin Bieber. You're listening to The Weeknd.
Start your day with Brian James in the morning. You'll get at least 10 songs in a row during your ride home with Julie Page.
Zach Sang Show.
Catch the Zach Sang Show weeknights 7 to midnight. And Kelly Fox weekends on your home for hit music. The Q102.9 and 104.9 in Prescott and Cottonwood.
Your daughter is having trouble learning French. Do you A, hire a tutor?
Bonjour.
B, enforce a French-only rule at home? Or C, watch some foreign films? When it comes to parenting, there are no perfect answers, but that's okay, because you don't have to be perfect to be a perfect parent. Teens in foster care will love you just the same.
Start a story. Adopt at theshelterpetproject.org.
Welcome back to Countywide. We've got just a few minutes left in the program. Cherry Virrey in studio today from Yavapai County Health Department, yavapaihealth.com. Flu shot clinics are going on right now, or you can call, to contact Yavapai County Health Department, no matter where you live in the county, and set up an appointment to go and get your flu shot there as well. Flu season runs October through May, but we're finding out now that with travel and everything else going on, the flu can always be around.
It never ends.
Yeah, it never ends. So there's always some kind of flu going on. Some preventative measures, okay? Back when swine flu was around, there was all kinds of, matter of fact, the restrooms had the placard on the wall, and it was all about wash your hands, hot water. The big thing we were teaching kids in school, I believe, was to cough into your elbow. Is that right?
Yeah.
Yeah, because I remember this so clearly because it was so different from when I was a kid. I mean, it was cough into your hands, but it was to cough into the sleeve of your elbow. So how else can I avoid catching the flu?
Basic preventative measures.
Spreading the flu even.
Yeah. If you have the flu, by all means, stay home.
Stay home.
Stay home, please.
Stay home.
Cover your cough. Cough into your sleeve. Don't cough into your hands. Because when you think about things of going out to the supermarket or just doing basic daily things, and you go and touch something and somebody follows you, you're not intentionally, but you're giving something to them that you don't want to.
You're leaving it everywhere.
Yes, you are. You're leaving a trail.
And you're picking it up everywhere.
And you are picking it up as well. Even though we have the wipes at the grocery store and everything else, I have never seen one person wipe down an entire shopping cart.
Right. But I can't walk around with gloves on my hand all day for the rest of my life. I can't do that.
No, but washing your hands every opportunity you can.
Hot water? Cold water? Soapy water?
No, it's not the temperature of the water. It's how long you wash for.
Oh.
So it's 30 seconds.
Oh.
And it's a general rule of nursing and medical is
really
30 seconds or singing the happy birthday song.
Uh-huh.
So washing your hands really good.
Cold or hot?
Cold or hot, as long as you wash for at least 30 seconds.
Well, I'll be darned. So you're just washing it off your hands. You're just getting that bugger to unstick and come off. Is that it?
Yes, absolutely.
Oh, wow.
Alcohol. Alcohol.
Drink heavily? Is that what?
No.
Rubbing alcohol?
Yeah, that's what my dad would tell you. A shot of whiskey.
Mm-hmm.
No. Gosh, I just went blank.
The Purell?
Yeah, like a Purell.
Okay.
That is just a
hand sanitizer.
It's a hand sanitizer, but it's not meant for all the time.
Okay.
It's more important to wash your hands than to constantly use that. Because when we talked about antibiotic resistance,
sure.
Okay, you can also build up resistance to stuff like Purell. You're not actually washing anything off your hands. It's a temporary.
What are you coating it?
Fix. Yeah.
Pretty much like a thin layer of.
You do, and after time, I mean, I can tell you, after time, it just kind of you built this coating up, and you can feel it on your hands. It's not good. You need to go wash that off.
Okay.
That is a temporary solution.
Okay, water's better. Okay, so stay home, and if you do get the flu, lots of fluids. Chicken soup, all that stuff, still the thing. Lots of fluids, chicken soup, lots of rest.
Lots of rest. See your primary care. There's a time frame for the Tamiflu, the antiviral. In order to get that, there's a very short window of time. So always, when you call ahead, let them know you possibly have the flu when you come in. They offer masks and hand sanitizers and tissues when you come in to prevent other people in the waiting room from getting it.
Cherry, thank you so much for coming in.
Thank you very much.
We'll see you again. Well, we'll have you back in the spring to talk mosquitoes, because that's always a big one in the spring. Okay, YavaPaiHealth.com again is the website. Thank you so much for watching and listening. That's today's Countywide, and we'll talk to you again next time.
It's time now for Countywide, a special presentation of Yavapai Broadcasting.